As of I.
Okay.
All right, we on?
We're live.
Hi, Facebook world. We good?
Hello. Welcome.
Hey guys, this is your Mayor Brandon Whipple. I am here with the great Commissioner Lacey Cruse, and also with professional staff over at the County Commission, Miss Michelle Calvert. Is it Miss or Doctor?
Just miss.
Just Miss. Okay, so Miss Calvert, she's the Director of Quality and Strategic
call her
Innovation
Doctor today.
at Comcare. Well, I just want to make sure I'm giving the proper respect to everyone because I know that Michelle's one of the experts here. So Commissioner Cruse, I know you have been a supporter of increasing mental health services for our community really since you've been elected, and this is one of the times during this pandemic where we are seeing a spike in a need for increased services. So we're really glad to have you here. And, also I just wanted to ask you some questions and get your feedback about how this current situation is affecting our community and possibly some resources out there for people who are watching.
Thank you. I know that this is a really tough time for everybody here, and so I was excited that Michelle agreed. And she's actually on a big screen right here, so I can't, anyway. But I'm thankful that you're here because really your boots on the ground, you understand exactly what's kind of going on or what's not going on. And I think it's important that everybody understands county's role in mental health services and how the need really is prevalent. But from what I hear, we're not getting a lot of calls. So would you be able to discuss that for us, Michelle?
Right. So here at Comcare, we are the community mental health center here in Sedgwick County. And what we're here to do is to provide mental health services to Sedgwick County in general. We have a crisis service that is available 24 hours a day. And since COVID has started, we've also created a support line that's available for anybody to call if they are having increased mental health symptoms. So overall, we're all feeling a sense of anxiety related to COVID, and we want to be here to help and support the community just as we always have, but now in different ways.
So there's two lines, right? There's one that's open from 7 a.m. and set to 7 p.m. on Monday through Friday. Is there a difference between the lines? Could you explain that for us?
Yeah. So we have, and we've always had, a crisis line, which is available 24 hours a day, and that's for individuals who are in a mental health crisis. And that phone number is 660-7500. So anybody can call that in a mental health crisis anytime. Our support line is a little bit different. And the support line is 660-1111. And that is staffed Monday through Friday, 7 a.m. to 7 p.m. And that's just for individuals who are having an increase in mental health need. So if you're having increased anxiety, depression, if you're seeing some struggles that you're having or maybe somebody else is having related to COVID or maybe not even related to COVID, we're here and available to answer those calls during the day.
Michelle, one thing, and I know that Brandon is the father of 3 young boys, and I have 3 kids at my house. And, really, I think that with kids being home, parents trying to be teachers now, there's a reason why we have professional teachers, and I have never appreciated them more than now. But, there is a lot of anxiety, and there's a lot of things that are happening maybe in the home. So could you just talk about maybe if you yourself aren't having the problem, or you yourself, but maybe a child or someone could you kind of just speak to that?
So one of the things that you can do if you're noticing increased anxiety or depression in your home, within your children, within your friends, we need to be there for each other right now and asking each other, hey, are you okay? How are you doing? What do you need? Be there for somebody and ask that one question, are you okay? And when you recognize that somebody has a need, if you can just be present with them, talk to them, have some of the shared experience that we're all having right now, talking through that can be really helpful. If you're not sure what to do or how to answer some of those questions, that would be a good opportunity to call the support line or even call crisis if it's an increased need as well.
So I know this pandemic has really been hard on everybody. Mayor, from your chair, I'm sure you're hearing from a lot of residents who are worried, having trouble getting services such as unemployment, small businesses who are unsure if they can reopen. I mean, I'm sure that I've seen your Facebook. I understand that you are very present. I don't know if you, kind of want to speak to that or any tips, that you
So-
have.
So yeah, really, one of the things I try to do as mayor, just like Commissioner Cruse, is to be as accessible as possible to the Wichita community, and I think that allows not only me to do my job well by getting feedback, but also a place for people to release their frustration. What we're seeing right now is completely just once in 100-year type disaster. We haven't seen anything like this in our modern history since I think 1920, 1919 maybe. So our systems, particularly when you talk about unemployment, they were just not set up for this at this point. I think there's a story that came out where their software was actually designed in like the 70s. Like that's that's how far back it goes. And being a legislator for the last 7 years under what has been really tight budgeting, no one has really prioritized making those investments to our Department of Labor, like we do other investments, such as into our Medicaid system, for instance. Medicaid, excuse me. So. We're seeing some of the holes in the system. We are seeing people who are calling, they're doing everything the right way. They are calling, they're going online, they're trying just to file for unemployment, and then on a website they wind up, not, because of so much traffic, it doesn't get through. And we understand, like we absolutely want to do everything we can to help people get through this process, even though as local officials, you and I have no control over a state department. But the frustration is real. I mean, it's another thing where I grew up, my mother was a waitress, my dad's a carpenter. We lived paycheck to paycheck. My mother's income was a real big deal for us. So the idea that restaurants aren't open, the idea that bars aren't open, knowing what my family growing up, how we relied on that service sector, and no one predicted that we were gonna have once in every 100 years this type of natural disaster that is making it so those people who make their money that way are experiencing not only a financial hardship, but a a prolonged time without work. The systems that we normally depend on right now are overwhelmed, and then there's confusion about kind of what looked like kind of last minute legislation that came down from the federal level on, well, how do we implement it? How do small businesses actually utilize this? Really my advice to people is, first of all, if you get your needs met, call 211, call our friends over at United Way. Make sure that you get that base needs met. Keep working on the website for unemployment. Keep reaching out to us as elected officials. We can kind of filter those messages back up to our friends at the state level. But overall, like, we're in this together. This is a natural disaster. We can't legislate the virus away. Like, we just can't. Like, it's like a flood, right? Where we know over the next 2 weeks, we are going to see an increase or the peak of what this should be. Right now, we're doing really well in Sedgwick County compared to some other counties that are similar size. If we do well these next 2 weeks, we can actually hopefully get back to normal or some resemblance of normalcy faster. So, but we can't open up a bar in the middle of a flood or the middle of a tornado. And we can't just open things up tomorrow and hope it's going to be okay, because we're still in the eye of the storm right now.
Yeah, there's got to be a strategy. I just posted about Ohio. They talked about how during the 1918 pandemic, how they tried to open things back up. But one thing you did mention that I just would like to touch on is, I think there's a lot of people who are kind of strapped for cash.
Yes.
Financial concerns are at an all-time high. And since we're talking about mental health, since we're talking about accessing these services, what does it cost? Michelle, can you speak to, the financial burden, if any, that somebody might have if they call your services?
Good question. And when somebody calls crisis and calls to talk to somebody to process through a crisis or situation, you're not getting billed for a phone call. And if you have a crisis and need to walk in the doors, our doors are open 24 hours a day. So you come in, and just as if you had a crisis any other way, you would be seen and you would be served no matter what. As far as our services are, we have a sliding scale fee, and that is based on your income and household size. And then we also take all insurance for the most part as well.
Okay. So could you
But
talk
we do
about
not want funds to be a limitation to somebody getting served.
That's really good to know, and I hope a lot of people will understand that, because help is available if you need it, and don't let financial concerns keep you from giving a phone call to someone to get that help that you need. The other thing is, could you just kind of, one thing that was really interesting is the number of calls, like the call volume.
Yes. So generally, in a 1 year period, we usually take about 60 to 70,000 calls overall. But right now, what we're seeing is we're actually seeing a decrease in calls coming in. And I think people they're staying at home more, and they are not getting out as much as they've been told, but they're also not reaching out as much. So I know that we are a very resilient community, and that has already been very evident. But don't hesitate to reach out when you're concerned or have a question or need some help. It's okay to ask for help. We're here.
So you talked about being open 24/7. Could you just tell people where to go?
So our crisis center is at 635 North Main, and we are there 24 hours a day. So you could call 24 hours a day, or you could come in 24 hours a day there.
And so just to keep our staff safe, I think if you're feeling ill, like if you're physically feeling ill, if you have a fever, it would be a good idea just to kind of let people know that. If you're feeling ill, as far as, fever, cough, those kinds of things, call about getting tested, in addition to if you have any sort of mental health needs. But, just to make sure that we keep everybody safe. Do we have any questions from our Facebook audience?
So if you have questions, you're watching us live on Facebook, please feel free to type those in. We have Megan with us, who will read us off all the appropriate questions.
None so far.
None appropriate ones or no questions?
Just no questions.
Okay.
So I just printed off some tips. There were a lot of people that were talking about, how to, for me, dealing with children and having my children at home, we're a musical household, we're an artistic household. I think that a lot of parents, I can only speak for myself, but it's hard to try and educate our children the way that our teachers may expect us to. And so I think being kind with ourselves about expectations about our kids' education and doing the best that we can. But I've been talking about if your kids don't know how to catch a ball, go teach them to catch a ball outside. Reach out to others as far as what they're doing. Spending extra time playing outdoors is very, very healthy for us all. Do you have any ideas?
So I'm just going to talk a little bit about my 6-year-old, AJ, and of course the 4-year-old, Tristan, trying to talk to them about what's going on. Chelsea, my wife, had to, who's much more patient than I am and way better at this. She actually has a degree in elementary education, so
so you guys have an actual plan.
Right, yeah, kind of, right? Like, normally I think it's like her plan to, that's why she does so well with me, is because she's used to, dealing with a classroom full of people who are less mature. But anyways, my 6-year-old gets it, where very tough conversation about, Mom, am I ever going to go back to my class again? Am I going to go see my teacher again? And Chelsea responds with, actually, no, when you go back to school, you'll be going on to the next class. And just his response is usually, I hate this virus. And don't you hate this virus? And, he'll talk to, we can't see grandma. We had to go drop off Easter eggs in front of grandma's house and let her come out and find them. After we sanitize them and everything. Mm-hmm. That's how we spend Easter, is kind of like, hey, we're being ninja Easter bunnies, right? We're going to go drop these off. We're going to leave before they see us, and then she can come out and we can FaceTime with her afterwards. And just those questions. Don't you hate this virus? And our kids get it, and it's important for us, I think, to be honest with them about what's going on. They don't understand why we're letting kids down the street come down, or they see them, they can't go play with them at this point. But the reality is, we're in this together, and we got to get through this by sticking to the plan, and bringing our kids along with that, letting them know that they're part of the solution. And it's hard right now, but we want to make sure that our community stays safe, and they're part of helping keep our community safe. Other than that, I think our teachers, as you mentioned, they weren't prepared for this. I've taught online classes before at the college level. It takes me months to prep for an online class, and we asked our K through 12 teachers to do that in weeks. To go, oh, by the way, your syllabus now that you've been planning or utilizing for years, that's no longer going to be in effect. You now have to be an effective teacher putting all that online. And they did it without complaints. I mean, that shows not only how resilient, Michelle said we have a resilient community. We do. I mean, we don't just say this stuff. Like there is actionable items like how our teachers pulled it together to give our kids that opportunity to continue education. And then in addition to that, how our free lunch programs started early. We have teachers who are out there making sure that kids who get their primary meals at school are still getting those meals. That kids aren't starving on our watch right now. So it's I think it says something about not only our community, but also about the professionals who work with our children. And it's we're going to get through it, and hopefully, we'll be stronger at the end of this than we were at the beginning. Megan, do we have any questions?
We do. We have a few.
Good.
There are some questions regarding kids working from home, and are there any plans to have schools still shut down in the fall? Potentially speak to how long do you anticipate will be under the stay-at-home order? Obviously, a governor-issued order, but are there any predictions on when it will be lifted?
So I'll mention briefly and then pass it over that just from what I learned yesterday from the review of what the governor said during her press conference. And I do want to, again, mention that at the city level, we have no authority when it comes to a stay-home order. That all passes to our good friends over at the county commission. But from the state level, it seemed like the governor, and I believe Commissioner Cruse probably watched this too yesterday, she seemed very interested in opening up the schools again. She mentioned, the schools got to open. We have to get back to normalcy during the fall. So I think that they are trying to get the schools open. The stay-home order has been extended at the state level till May 3rd. And really once May 3rd hits, unless more action happens at the state level, now the rest of it falls to the county level. And one of the good things about our partners over at the county is they have been making decisions based on the best research and the best practices from the public health professionals, not just knee-jerk political calculated positions. But we got a commissioner with us right now, so we can ask if there's any plans.
Well, I think we have to, right now it's until May 3rd. And that's where we're sitting, and unless something changes over the next couple of weeks. I think it's important if we don't see any huge spikes, right? I said the 4 things today were, can our hospital systems take care of those who get sick? Can we track those who have been tested positive with the people that are around them? Can we, oh gosh, I rattled them off this morning. Do we see the spikes, or do we see the level of cases going down over 2 weeks? And then can we test everyone? Those were kind of the 4 things. The other things are, once we open things up, is it a shotgun approach where you open everything up at once, or is it a layered approach? The reality is we're probably all going to do we're going to do things differently. You're going to see more people wearing masks out in public. We're all probably going to wash our hands a lot more just because we've been doing it for so long. The other thing I think that we really just need to remember is that these decisions are not fun. Nobody really wants to make them. And at the end of the day, there's going to be those who agree and those who don't agree. But bottom line is we can all be kind to each other about how we're handling this situation. And I think that goes back to the mental health topic today is really, I struggle with these decisions. On one hand, I want to keep public health. Everybody is as safe as possible, as well as possible. But then when you look at the mental health effects on those small business owners, those parents at home, the country didn't just stop. All the problems with child abuse, with domestic violence, all of these problems didn't just stop, right? They just changed a little bit. And so, for me, it's all of that wrapped into one. And that's kind of how I'm trying to make decisions. And I know that my colleagues are doing the same kinds of things. I can't speak for them, but they've been very communicative, and we've all sort of, I know that Commissioner Howell actually wanted to have a meeting about the stay-at-home order, and then because of the governor's press conference and our expectation of her maybe pushing things back. So long story short, Megan, we're just going to have to kind of see. But in my opinion, it has to be a layered approach about how we sort of get things back to whatever that normal is going to become.
Yeah, we should always err on the side of safety. And, I just got into my 4th month as mayor this week. This is my 4th month. And some of the stuff I get back, and I get it, people are upset, but no one wanted this, right? Like, I much rather be planning Riverfest, be doing our State of the City that we planned, and would have been an incredible way to honor our public employees who are doing amazing stuff. Doing our parades. Like, we have to put all that stuff on hold as elected officials, and it's not. It's nothing that we enjoy doing, and so. I think that we want this to be lifted and things to get safe just as much as anybody else as well. But
Megan,
we have more
you got
questions.
another question?
We do have a couple other questions. Joshua wants to know why testing for COVID is so expensive.
It's a good question.
Is it the lack of kits and availability? Probably maybe a question for our partners at a different level of government.
Yeah, I think that unfortunately we don't set the rates of those tests. I don't have a real strong answer on that. I'd be happy to reach out to our health director to see if she has an answer, but I'm guessing it's because it's not set by us. I wish that we could test everyone. One thing that we were talking about is if we could test everybody, how much would that cost? If we could allocate those resources, our colleagues in Johnson County, they allocated, I think, $500,000 for some testing, and could we do that here? And we are trying to set up a more robust testing operation that could allow us to test more folks, but when you only have so many testing kits, it's important that we reserve those for those who are showing the symptoms and signs.
We on the weekly press conference or almost daily press conference from the governor, Kansas is not getting as many of the tests because they're limited federally as some of the states who have been hit harder with this, and that's going to be a game changer. If we're able to, in the next month or so, start getting more tests, then we can actually identify clusters. Then getting back to normal will be a little more safer. And I'll tell you, as an elected official who went to DC, like, we thought this was a good idea. And then all of us got quarantined who showed up to class. We couldn't get tests. Like, the city, pretty much a quorum of city council couldn't get tests. We had to wait until we had symptoms. So tests are limited, and they are very stringent on who gets to get tested, and that, I think, is loosening, but also...
Yeah, it has actually loosened up this past week.
Good.
So, different criteria.
Good. Other questions?
I think we have two more. We have time for two more.
Okay.
And Angela wants to know if we can expect things like parks for kids to open in May as part of what you mentioned, a layered approach of sort of opening things back up.
I hope so.
So-
I really do. I'll have to defer to the mayor.
Because the city parks, as you guys know, are open except for the equipment. Pretty much, and this is the interesting thing, is I think we wind up talking a lot about what what is essential versus non-essential. Here at City Hall, we're making decisions based on what's safe and what isn't safe. It is safe for you to go to the park with people in your immediate household, and as long as you're socially distancing from other people. The common touch areas where kids who are, putting their hands on playground equipment, that type of stuff, that was the reasoning why the playground part of it was closed. And I think that, we have to do, just like what the commissioner said, we'll be looking at, well, what's the safest way moving forward? And we'll know more about the virus by then, where, if it is spread by droplets and it's really hot in the summer, is there less chance that those droplets will actually stay on, on our equipment? But we hope to obviously get back to normal as quick as possible. But we need to err on the side of caution, and particularly with our kids, because if your kids are anything like my kids, they carry a lot of germs, and they're pretty dirty. So we want to make sure that those common touch areas, particularly with children, are limited until we get over this hump.
So we've got time for one more, and then maybe we can plug those numbers again. But how many individuals does Comcare serve annually?
So generally we serve about 17,000 individuals per year, give or take a little bit here and there. So that's our general population.
It's a lot of folks. One thing that I was hoping to focus on this year was really reducing the stigma of getting help. That to me, I grew up in a family who was kind of riddled by suicides, depression, those kinds of things. So I get it, it's out there. And a lot of people just don't want to talk about it for fear of being ridiculed or made fun of or whatever the case may be. But I think everybody has some issues or some concerns, and, not being able to talk about it, I think, is one way that just makes everything bottle up inside. So can you just speak to that real briefly before we kind of...
Yeah, absolutely. I think that just as I talked about before, a lot of times people don't want to come forward with their own issues, but for you to see someone who's struggling and say something, it completely opens the door. So if you see something, say something, ask, are you okay? And that simple question can open up that door to get somebody the help that they need to survive. So if there's one thing I can really push, if you see something, say something, ask someone, be present for them, and they may be present for you as well.
You want to plug those numbers again one more time for us?
So our support line is 660-1111, and then our crisis line is 660-7500. And I know that one of the things that you talked a little bit about, and I want to push again, is just to make sure that if you're asking other people how they're doing, don't forget to take care of yourself. So listen to your body, listen to your needs, take care of you. Do get out, enjoy some sunshine, nourish your body, help yourself to be healthy, and really connect with other people. Being socially distanced makes it a lot harder to connect with others. But kind of just as we're doing, connecting via video, we can connect with our family and our friends and loved ones that way as well. So call your grandparents, call your friends via video, and connect with them that way too.
Awesome. Thank you so much for being on today. I really appreciate you taking the time to share with the community. And maybe we could put up, do you guys have an email if people maybe don't want to call? Because some people don't want to do that.
So you can go to our website, and we also have a program called Beating the Blues. So it's Beating the Blues at sedgwick.gov. And our Beating the Blues program is an online, it's free, it's an evidence-based program. It's a cognitive behavioral therapy program that anybody in Sedgwick County can participate in, like I said, for free. So they could go to our website and get a little bit more information about that. But something that you want to participate in is Beating the Blues at sedgwick.gov.
Awesome.
Well, thanks a lot, Commissioner, for joining us today, and just really want to thank everyone over at Facebook, on social media right now for being engaged, and of course we want to thank Michelle for taking the time to answer questions and be here with us as well. We are always accessible for the people who are watching. If there's any information in that we could pass along, or if you have any questions, please let us know. I think that's it. Are we good, Megan?
We're good. Thank you, guys. Thank you for having me.
Of course. Thank you. Take care.
Yeah.
All right.